Okay, now I want to talk about another kind of scary term, but it's actually not so scary. Okay, it's called pharmacokinetics, right? Pharma means drugs, right? And kinetics means movement. So this is literally the movement of chemicals or drugs in the body. And the way that drugs get around your body and reach, their targets for drug action are through the blood, right? Through the bloodstream. When we talk about the availability of drugs to their biological targets, your book describes this is called bioavailability. Drug reaching receptors, right? Or in some cases transporters, or in some cases enzymes, or in some cases ion channels. They're reaching their protein targets. Drugs must reach their targets, right? And so methods of drug administration, administering drugs to their targets and making them bioavailable include, the most popular, right? If you're going to have to take some kind of drug, the best way to take it is through the mouth, right? Through a pill form or something. And so this is oral administration. It's the most popular, of course, because it's easy, right? And it's also painless. And there are some drawbacks, however. It turns out that by having it enter through, the mouth, it actually enters into the acid stomach, environment of the stomach, right? And it can be broken down quite significantly. And some drugs that we'll talk about actually do get sort of degraded by enzymes, of course, in the stomach and small intestine before entering the bloodstream. If food, for example, can slow the passage of certain drugs through the stomach and into the small intestine. So particularly fatty foods, so if you eat something before you have a drink, you'll end up absorbing, less of that alcohol because more of it'll take longer to get through the stomach and small intestine, and more of it will be degraded there. And also blood from the stomach, and small intestine goes directly into what we call the hepatic circulation, or circulation in the liver. It goes straight to the liver. This is called the first pass effect. And the liver is the site of many enzymes, many proteins that degrade, that break down various drugs. So, in some ways this could be a plus of oral administration. You're actually reducing, the amount of drug that's going to actually reach the bloodstream and then become bioavailable, to receptors and other proteins where the action occurs. But it could also be a drawback if you're trying to deliver a consistent amount of drug, and a large amount of drug. Okay, so that's oral administration. Intravenous administration is, of course, an injection directly into the bloodstream, right? It turns out it's the most rapid and, an accurate method of delivering a precise amount, of drug, because it's, you know how much is coming through the needle, and, it goes straight into the blood system, so you know how much is going to become bioavailable. Drawbacks include, of course, an overdose potential. I'm assuming you know exactly how much is in the needle. Maybe you don't know how much is in the needle. So there's significant overdose potential. Also, there's no chance to sort of pump the stomach, to provoke, some sort of an emetic response to try to clear the system, of the drug. Once it's in the bloodstream, it's circulating, it's going to reach its targets. And it turns out, a lot of drugs of abuse that are administered via needle are of varying potency, right? Varying composition. There could be, other substances in there too, so you don't necessarily know what's going in to the bloodstream, and there's really no way to stop it from reaching targets that could have pretty negative effects. There's also often infection risk from shared needles in terms of the passage of various viruses, and other infectious organisms from one individual to another. There can be also inflammation, of the heart or of the circulatory system if there's some sort of infection that gets into the blood system. So intramuscular is directly into the muscle, and this actually is done because it promotes a sort of slower, more even absorption of drug over time. And the drawback you can probably, predict. It hurts. It's like you have to get it right into that muscle. And, it's unfortunate that children need so many vaccination shots when they're very young, and the way they deliver them is generally intramuscular, often through the leg, and that's not a particularly, it's not a painless way of administering drugs to anyone. Intraperitoneal, or IP, is luckily rarely used in humans, although there are some odd moments when it is. It tends to be more of a research technique. It's literally injection directly into the peritoneal cavity, which is the organ cavity. So they, inject a rat, for example, directly in to its peritoneum. Not again, it gives you rather rapid effects, right? Because it's heavily vascularized in the organ systems. It's a useful technique for delivering drugs to lab rats. Subcutaneous, or SC injection, is basically under the skin, right? Subcutaneous, below the skin. It's usually, it promotes sort of slow, steady absorption. You can actually speed it up, right? Depends on capillary innervation. So if you were to rub the area, you would actually, expand the vessels in that region. It gets red, and you can speed up absorption. Inhalation is popular, of course, for nicotine, right? People who smoke cigarettes, or marijuana. People who smoke, marijuana. Anything smoked, basically, and also for the delivery, for example, of anesthesia medications too. Actually, are often delivered through inhalation. There's rather rapid absorption in terms of inhalation, because the blood goes, the drug goes to the lungs, which are heavily vascularized and are being oxygenated for sort of direct delivery to the central nervous system and other body tissues. So it can be very rapid absorption. From a cigarette, for example, I believe its nicotine can be absorbed within or can reach central nervous system receptor targets in about 7 seconds from the point where you first inhale. There are significant drawbacks, of course, to inhalation, right? Particularly irritation, lung damage, right? Those alveoli in the lungs that are heavily vascularized are actually quite sensitive to the presence of a lot of substances that are found in burning tobacco or burning marijuana. There are compounds, tars, etc., that are actually carcinogenic and can promote cancer. So yeah, the toxins produced by burning are a significant concern. Topical means sort of applied directly to mucous membranes. So, an example would be like snorting cocaine, right? Or so any sort of direct application to mucous membranes of a drug. And the drawback, of course, is that these membranes are sensitive and they can be damaged, right? You can, have the nose sort of retract and some significant damage to the nose with continued snorting of certain drugs. Transdermal means across. Trans means across. Dermis is the skin. So those are those patches that people wear, for example, like a nicotine patch, to deliver sort of a steady, regular, supply of nicotine over many hours. Epidural means that you're actually injecting around or beside, the dura mater. Remember, one of those meninges that cover the central nervous system. It's needed for certain drugs that would not otherwise cross what we'll describe in a little bit as the blood-brain barrier, that you can't necessarily deliver to the central nervous system because they don't cross the BBB. Okay.